Good afternoon, everybody, and welcome to this afternoon's NCCT Prep session. Today, we are going to finish up the medical insurance section. And I've already shared my screen, and as you can see, I am not using the paper that I was using the last couple of weeks. I'm actually in the NCCT's website, and I'm going through their interactive review that you guys can actually sign up for and purchase if you feel so inclined. It's fantastic. I've kind of gone through the question. A lot of the questions are the same. So I kind of went through a bunch of them, the ones we've already gone over the last couple of weeks, and we're going to pick up kind of towards the end. We're going to finish it up. So I'm just going to talk through these one by one since there's no students on with us today. So we're going to start with number 39. The patient has health insurance that covers 70% of her covered expenses that she has incurred, which qualifies for reimbursement. The patient's responsibility will be 30%. This type of cost sharing is referred to as copayment, deductible, covered expense, or coinsurance. And as we discussed previously, guys, when you see those percentages, that means she has a 70-30 plan, and that is coinsurance, right? Yes, you are correct. Coinsurance is splitting the bill between multiple parties. Excuse me. These parties include the insurance company and the patient. Copayments and deductibles are part of the patient's coinsurance. Covered expenses are the insurance company's part of the coinsurance. Level 2 visit for a cold. I have to break out my calculator. $95 contract rate, 80% paid from the insurance, 20% due from the patient after the deductible is met. $200 deductible with $49 met today. Jeez Louise. Which of the following is the amount owed by the patient? All right, so I cannot math in my head, guys. Calculator, okay? So we've got $95 contract rate, 80% paid, 20% due from patient after the deductible. All right, actually, we might not need the calculator after all, because you can see 20% due from patient after the deductible is met. The patient has a $200 deductible, and only $49 has been met to date. So they still have up to $150 worth of deductible, or $151 worth of deductible to pay. Which of the following is the amount owed by the patient? It should be the entire $95, because all of that's going to go towards the deductible. Yes, your answer is correct. Yay. Which of the following, and just so y'all know, I don't have the answers to these. I'm working through this with you. Which of the following is contained in an EOB? Select 3 correct answers. All right, so we know from Miss Marcia that if there's a question that says select 3 answers, that's guaranteed to be on your exam. So let's figure this out. Which is contained on an EOB? Diagnosis codes, deductible applied to visit, contractual adjustments, dollar amount paid, and the patient's social security number. All right, so the EOB is all about explaining the charges, right? The claim, the billed amounts, the paid amounts, all that. So let's break it on down. The EOB, let's see, deductible, that's going to be one of them. Contractual adjustments, how much the insurance adjusted off, that'll be one. And the dollar amount paid. Diagnosis codes and social security number, they may be listed somewhere on there, but the EOBs are all about the money. We're looking for dollars. Yes, your answer is correct. All right. Patient asked the insurance and coding specialist to bill her secondary insurance first because the coverage is better. Which of the following should the specialist do? Select the 2 correct answers. A, deny her request. B, inform the provider. C, explain the guidelines and bill the primary insurance first. D, report the fraudulent patient request to the secondary insurance company. Collect the copay for both insurance plans. Okay, so First off, you're going to deny that request. You want two. I would say explain the guidelines and bill the primary insurance first. You're not going to report the fraudulent patient because technically you're not going to allow her to commit fraud in the first place, right? We're going to do our jobs and our due diligence and do the right thing. And you're not going to collect the copay from both plans. It'll be the primary. I would inform the provider too, but I think the deny request and explain the guidelines are going to be our correct answers on this one. Yes, your answer is correct. All right. According to the patient's insurance plan, the copay for an office visit is $20. The copay for a specialist visit is $30. The patient had a carpal tunnel release done 2 weeks ago by an orthopedic surgeon. The patient has come into the orthopedic surgeon's office today for a follow-up visit. Which of the following is the copay? So, all right, we're talking about an orthopedic surgeon. That's going to be a specialist, right? Right. So it should be that $30 specialist visit. There is no copay due at this time. This is because it is during the global surgical period of 90 days. Trick question there, y'all. During this time frame, all services associated with the treatment is not billable. So they will throw some trick questions at you apparently. Normally it would be a $30 copay, but since she had this procedure done, and how we're supposed to know off the top of our heads that a carpal tunnel release has a 90-day global time frame, I'm not sure, but there you have it. They want you to know that. So sorry, the correct answer is no, because she's within the global period. That's a trick question. Watch out for those, y'all. A patient was hurt at work and seen in the physician's office today. The patient is covered under Medicare and BCBS, which is Blue Cross Blue Shield, and is also covered under workers' comp for this injury. Which of the following is the primary insurance and the secondary insurance? All right, so in our last meeting, we talked about workers' comp. It is always billed first, right? All right, so the workers' comp is primary, BCBS is secondary. And I'm just going to skim through the other answers just to make sure. So it is going to be A, workers' compensation is the primary. Blue Cross is going to be your secondary because that's a commercial insurance. And your Medicare is going to be tertiary in this instance. Okay. Yay, I am correct. Which of the following information will be required for an HMO that may be unnecessary for a PPO when submitting a CMS 1500 form? A, the patient's birthday, B, the insurance name, C, the referring physician, or D, the diagnostic pointers. All right, so it is going to be C, referring physician, because y'all remember, people who have a PPO can go to a specialist anytime. They do not have to have a referral, but an HMO does require a referral. So there is a spot on a claim form, a CMS 1500, and I think it's right above the diagnosis codes, where you can put in referring physician. There's also a couple of other designations that you can make there, like referring physician or rendering physician, things of that nature. But what they're looking for here is referring physician, because in order to see a specialist, someone with an HMO plan always has to have a referral from their primary care doctor. All right, which of the following statements should the insurance and coding specialist use to advise a patient that his annual deductible has not been met and he is responsible for the full cost of today's visits? According to your health insurance benefits, you owe $130. A, and there is no need to use your insurance for today's visit. B, this is just an estimate. Your insurance carrier will reimburse you the difference. C, and you can reschedule the visit for next month. Or D, based on your benefit details. All right, so the patient's paying his deductible. So number one, it's not going to be A, because we want them to use their insurance. Um, so it'll count towards their deductible. If we don't file it with the insurance doesn't process it and doesn't count it towards the patient's deductible. So then they get to pay more. So it's not A. This is just an estimate. Your insurance carrier will reimburse you the difference. No, they won't. No, they won't. They don't do that. That's not going to be it. We know the full cost of the day's visit. It's not an estimate. We know they owe their deductible. C, you can reschedule the visit for next month. I mean, I guess if they don't want to pay it, yeah, but no, it's going to be D, based on your benefit details. The reason we know that is because we looked up their plan. We found out how much their deductible was. We saw how much they've paid in so far this year. And we know that they owe at least $130. So all of today's visit is going to go towards that. And it's going to be, you need to tell them based on your benefits, based on your plan details or your benefit details. '47, the Medicare Secondary Payer Questionnaire is a form that A, patients fill out to determine if there is other insurance designated as the primary insurance. B, the medical office staff fills out to determine if patient is eligible for Medicare benefits. C, the medical office staff fills out when they have confirmed that the patient has Medicare as a secondary insurance provider. Or D, the provider fills out when they are not sure if the patient has other insurance. All right, we've gone over a question like this one before, so we know that it's going to be A. The patient fills out to determine if there is other insurance designated as the primary. This is in cases of like, there are special benefits, so like black lung and things like that, that they will be primary. If the patient has that particular condition, that coverage will be primary to Medicare, to their Medicare benefits. When a patient fills out an intake form upon registration, which of the following vital information is needed on the form in order for the provider to get proper reimbursement for services? All right, so it's, again, what is that information that we need to verify and file this insurance claim? Patient ID and address so that a bill can be sent to the patient, patient's bank account information with consent to withdraw, insurance information, a copy of the card so the claim can be sent to the insurance carrier, an attached letter from the patient stating she will pay for the services at checkout. All right, so it's going to be insurance information and a copy of the card so that the claim can be sent to the insurance carrier. We're trying to get reimbursed, and no patient in the right mind is going to give us their bank account information. All right, patient has a bill of $1,000 and his portion due is $590. The insurance payment portion is $410, right? $590 plus $410 equals $1,000. The patient wants to know why he owes more than the insurance. Which of the following actions should the insurance and coding specialist take? My students know this one off the bat. My students know this off the bat. So let's go through what their options are. A, provide the insurance company's phone number and tell the patient they must speak with the insurance. B, provide the patient with a copy of the office fee schedule and financial policy. C, print out a copy of the patient's account and review the charges and responsibilities for payment with the patient. Tell the patient you will contact the insurance on their behalf and have the insurance company call them to review the bill. So if any of my students were in the class, they'd be screaming A right now, because that's one of the few things that we do not explain to people, why their insurance paid what it did. We can only say whether it paid or not and tell them how much. We explaining why they paid a certain amount and not more is beyond our control, and it's not even information that we have access to. So we need to tell them that they have got to contact the insurance company themselves, and no, we cannot contact them for them. We can contact them on behalf of our provider. We cannot contact them on behalf of the patient, okay? But you can give them the phone number and all that fun stuff. Print out a copy of the patient's account and review the charges and responsibilities for payment with the patient. You can do that first. Do that first. Explain to them, why Okay, your plan says that you pay this percentage and the insurance covers this percentage. That we can explain, right? But anything beyond that, you're going to tell them to go to their insurance company with it. But as far as the charges on their account, yes, we can explain those. We can explain what they paid. We can't explain why. So this question, they wanted us to explain to the patient what the charges were, which that's not what I took from the question. Again, trick questions and watch them. All right, when submitting a request for a pre-authorization, the billing code and coding specialist should A, wait until the procedure has been completed so that the codes are correct, submit codes for any scenario that may arise during the procedure, not code anything higher than the procedure that is expected to be done, or submit the request as close to the date of service as possible. It's another one of those repeat questions that we've already been over. So we know that we're going to submit codes for any scenario that may arise during the procedure, right? I think the previous question, the answer was a range of codes, in case of whatever. Answer is correct. All right. The patient is a 3-year-old. Both parents have private insurance. Coverage on the patient, the mother has a healthcare savings account. The primary insurance belongs to the parent. Is where our birthday rule comes in, right? Who was born first with the healthcare savings account, with the earlier birthday in the year, or with the best insurance. And we know birthday rule, it's going to be the earlier birthday in the year. You are filing a claim for a hospital stay for a patient. The patient has Medicare Part A, B, C, or D. And I always get my coverages mixed up. So let's see, hospitalization. I think that's going to be A, I think. Yay! Medicare Part A is a hospital insurance. Part B is outpatient. C is for additional private health plans. And D is for prescription drugs. So A is hospital, B is outpatient. I'll remember that one day. Eligibility for Medicaid may change as quickly as daily, weekly, monthly, or yearly. We've been through that question already too. I think it's going to be monthly. In an HMO, plan members are required to obtain a referral to a specialist from their primary care doctor, right? Right. Questions we've already been over. Lots of duplicates. Just changing up the wording on y'all. All right. Workers' compensation policy guidelines are determined by A, the federal government, B, the state government, C, OSHA, or D, the Employees Human Resources Department. And let's see, workers' comp, that should either state or OSHA. Was it federal? I'm gonna go with OSHA and see what they say. No, workers' compensation guidelines differ by state. Each state government is responsible for publishing its guidelines. The federal government does not determine workers' comp guidelines. OSHA is the Occupational Safety and Health Administration, deals with safety in the workplace, but does not deal with workers' comp benefits. And Employees Human Resources Department does not determine workers' guidelines. Okay, so long story short, state is determined by each individual state. Under which of the following circumstances does a patient need a referral from their PCP or their primary care physician? For a woman's well exam, if the insurance plan is a PPO, if the insurance plan is an HMO, for Medicare. We've been over this one again and again, so we know it's going to be an HMO. All right, we're almost done, guys. A few more. Billing practices that prevent the total payment received from multiple insurance companies from exceeding the patient's total bill are known as A, abuse prevention practices, B, coordination of benefits, C, fraud prevention practices, or D, assignment of benefits. think that's going to be coordination and benefits. Yay! That one kind of threw me for a second. All right. Patient is referred to a specialist by the primary care provider. Pre-certification is required for this patient's specialty visit. Which of the following actions is required by the insurance and coding specialist to obtain authorization? Who are we going to contact for a pre-authorization? The insurance plan, right? So it's going to be, let's see, patient, claim, contact. Yep, C, contact the patient's insurance provider. A patient has just left the doctor's office with a new prescription after a scheduled follow-up visit. If the patient's primary insurance covers the bill completely, her secondary insurance policy is still going to be billed, is still going to pay the fee schedule, will not be used, or will apply. Very similar to a previous question we went over. So we know that if the primary insurance covers it all, the secondary insurance will not be used. All right, when filing a claim in an outpatient setting, which of the following forms should be used? What do we use to file claims? CMS 1500, right? Or HCFA 1500. Yay. All right, if a married couple is covered under both spouses' health insurance and the husband is picking up a prescription for himself, he should get to pick which insurance benefits to use the insurance benefits with the least expensive out-of-pocket expense, use his insurance benefits alone unless he forgot to bring the card, use both of the insurance benefits as they apply to the pharmacy purchase. And again, this is very similar to a previous question that we did. So we know he's going to use both of his insurance benefits as they apply. All right, just two more. After a patient is seen for a follow-up visit, the physician orders additional diagnostic testing. Which of the following does the insurance and coding specialist need to obtain? The allowed amount, pre-authorization, the advanced beneficiary notice, or the referral? That's going to be the pre-authorization, right? Before the services are rendered. Righto. Which of the following is the percentage the patient pays for covered services after the deductible has been met? So we cover our deductible and then what? It goes to the percentages, right? So that's going to be our co-insurance. And last one. In each calendar year, a specified amount is to be satisfied before benefit payments can be made by the insurance plan. This specified amount is called what? The co-insurance, the deductible, the copay, or an out-of-pocket expense. So the amount that is paid yearly that we have to pay before our co-insurance takes effect is our deductible, right? Yeah, y'all knew that one. The answer is correct. Yay! And it says question 64 of 64, so. Oh, it starts over. All right. Well, we went over all of those. So, all right. Well, that, guys, is going to wrap up medical insurance. I'm not sure who is going to be taking over the next section and hosting for you guys, but we will let y'all know as soon as we can. I do believe we are planning on keeping the meetings at Tuesdays at 4. So thank y'all for joining me. Thank you for tuning in later and watching this. We appreciate your time as always. And good luck with your exam, guys. We wish you the best. We want nothing but your success. And as always, if you need anything, copies of packets, the website for NCCT, get with your instructor and we can email you all this stuff, okay? All right, so you guys have a great day. Bye-bye.